Welcome back, you beautiful bravehearts, to the Bhn Powerpack Show. I'm Dr. Darryl Wolf, and I'll tell you something, we're power-packed today. We've got three beautiful women on from different parts of the country, and they're going to be talking about their stories, okay? But let me just give you a backstory here. For those of you who do not know, okay, all right, I opened my first clinic, all right, when I was 26 years old. Okay, I'm now 47. So what do we got? We got 41 years, okay, in the trenches. And understand something, all right? The day I started, I was always a health rebel, and I will be a health rebel until the end of times, because guess what? There's hardly any health practitioners out there, okay, because they've all been programmed. And that's God's truth. You know, it's one thing to have a big mouth, and then there's one thing backing it. And I back it with my money-back guarantees on courses, trainings, certifications, and treatments. And I'm not saying it because I want you to come. I'm trying to tell you that if you're that good at what you do, why aren't you giving a money-back guarantee, Mr. Practitioner, Mr. Doctor? Seriously. And I'm going to tell you why. Okay? Because 99.9% of the population that is into healthcare are not into healthcare. They're into sick care. And I'm going to tell you something else. When I got into practice, it was inky-dinky schnitzel house. I had to deal with asthma, arthritis, constipation, hemorrhoids, okay, all right? And guess what? I had to deal with the odd autoimmune disease, because back 41 years ago, do the stats and you'll find out that guess what? It was a walk in the park. Oh, but now human beings have changed and we don't know how to heal anymore. And the God that created us this dysfunctional meat suit. Let me tell you something right now. The medical system should be going to jail, not the people in it, because you can brainwash any human being to do bloody well anything. And that's the truth. You know, remember the last thing they did with the big pandemic? Okay, and people would come to your door, like they came to my door like twice a week. I'm not making that up. There's enough video out there to prove it. I'd video every dang time they came. And they'd say, Dr. Wolf, we know you're in there. We're just doing our job. I'm just doing my job. And I used to yell out, it didn't take much money for you to do your job. Now get off my property. Now understand something. The majority of the population is not going to stand up for themselves. They're going to be bowled over again. And it's not because they don't believe that we're going down the same path. It's because, guess what? I'm going to be doing a talk on this, and it's all about how the subconscious is actually built for fear, until you go long enough and strong enough, okay, that you know how to stay in the present moment and own it, that your brain was actually programmed to bring you down and the rest of your family. Now, let me just tell you a little story. I just told you that I dealt with inky-dinky schnitzel house. When I came in the business, it was easy. It was breezy. My God, constipation, hemorrhoids, arthritis, asthma, okay? All right, there'd be the odd cancer patient, the odd lung patient, okay, stage 3 or 4 inflammation throughout the body. But guess what? It was so easy to turn them around. There wasn't any blue light. There wasn't any 5G, wasn't any 4G, wasn't any 3G. Oh, forgive me, there wasn't any 2G. Oh, there was just 1G. Okay, and guess what? Computers just came out even after I was in business for a few years, like 10 years. Isn't that something? That's how old I am, dinosaur. And the reality is this, guess what? Do you actually think that I started off as a massage therapist, colon therapist, acupuncturist, and I was selling nutritionals, and they were just supplements. They weren't nutraceuticals. I didn't know about vibration and light. I did know about it. I really didn't know a lot about it, because guess what? You have to turn over the rocks. Now, it's so easy to learn the truth if you want to learn the truth. Thank God for the web, and sometimes the web is the worst thing we've ever done. It all depends on what you click on, right? Here's the deal. If I take 90% of the people that come to us, even the people that come to Extopasi Watanago, they come to learn how to be healed. If I were to take the same strategies and ideas that 99% of the practitioners are still working with, that I worked with, okay? I stopped working with those a quarter of a century ago. So you're going to tell me that people aren't sicker? You're going to tell me that people aren't sicker? Seriously? Okay, right now in the United States, 39% of the population is obese. I didn't say overweight, I said obese. All right? Obese. And do you know what obesity is? Guess what? Isn't it nice that they did that for you? They changed obesity from 10 pounds to 40. Aren't you more comfortable in those stretchy little pants of yours? Yeah. Okay? Let me tell you something. You're not going to be comfortable for too long because guess what? They're just harvesting you. They're harvesting everyone. And understand this. We now have 92% of the population with an autoimmune disease. Take a look at some of these stats here. Okay? All right. In 1992, 26.5% of women experienced urinary incontinence. That means that 26 women. Okay, guys, guess what happens? If I took it back to 1950, all right, it was, are you ready for this? It wasn't even 1 out of 100 women were dripping urine in their underwear. In 1992, 26.5% of them were. And now 60%, 62% of all women are dripping continually throughout the day into their panties. I mean, I should be in the panty liner business. It'll probably be the only thing that won't get economically depressed in the next few years because it's only going to get worse because all of these women are pooping in their bloody pelvis. And guess what? Your doctor will never talk to you about that because guess what? Even if you were a doctor and you came from Stanford University, hallelujah, brother, you get 80 minutes of nutrition and it's going through 4 case histories of people and what they ate. Okay? All right. So yeah, you go to your doctor. Why don't you just go to your doctor? Just go to your doctor. Go to him. Okay? Chemotherapy, radiation, drugs, surgery. Tell me he's got anything else for you. He's not allowed to talk about anything else. Or he'll get spanked. Nobody's spanking me. I've already been spanked. I was spanked just 2.5 years ago that 3 people died under my care and 2 of them I never even met. So whatever. You know what? You can make up any story that you want. You can make up the story that your medical doctor is actually a doctor. He's not. He's a physician or a surgeon. You can pick 1 or 2 of those or both. All right. So now in 1987, 0.73% of the people experienced depression. In 1997, okay, 2.33% of the population experienced depression. 29% of the population now is depressed, clinically depressed. And you know why they're depressed? Because guess what? If you only produce a little bit of serotonin, you're going to go into depression. And you only produce a little bit of serotonin because you believe they're BS. You're so fearful. You're so full of anxiety. Henny penny, the world's going to come down. Happy people and people that are joking around and people that do not say I'm buying into the suffering of this world, okay, will continually allow serotonin to come into their body and you'll never have depression. I don't even know what depression is. I can spell it and I can smell it, but I'll never become of it because I'm not going to suffer for you or anyone else. I need to make sure that I'm healthy, okay? All right, so when you call, that I'm going to be logical and grounded and aligned to tell you that, guess what? Your brain is just a computer. You've been running the same programs over and over again, the end of the world scenario. Nobody loves you, okay? All right, which is not true. So now you've got depression and you're going to have, what's wrong with you? I'm depressed. Why? I don't know. Okay, it's only because you tell the same bloody story over and over again and you have enough depressed friends that you can tell them the story and they'll actually sit there and listen to it. And every time you tell that story, you embellish on it and you make it worse and worse and worse because whatever you feed gets worse. And understand something. I have this beautiful shirt because I have a beautiful life. I have a beautiful home in Mexico because I decided to have a beautiful life. I decided that I matter. I decided that I am worth everything. And the people that surround me, Okay, I live in the middle of a jungle. I have a pool that I jump in the morning and I go at night. You're going to go, oh, who do you think you are? Who do you think you are? You must have got that by killing people. You know what? I'm going to tell you something right now. If you were to learn how to mind your own business and really fall in love with yourself, guess what? It is unlimited. And that which created the whole universe is beyond love. So let's just say that. So 30% of the population is depressed. And they're depressed because they are malnourished in minerals, electrolytes, trace minerals. If they were taking my Beyond Dormus minerals, it would change them overnight. And it would. 80 drops, that's all you got to do. It's inexpensive. And guess what? And if I told you to smile, you'd probably give me your middle finger because you're like, oh my God, why should I smile? Life isn't going my way. Well, it's never going to go your way because of the way you talk, the way you walk, the way you think, the way you drink. Okay, so take a look at this. Look at autoimmune diseases, guys. Look at how they have risen. Okay, is this because God has cursed us? Oh, probably for some of you. Oh yeah, because you've been so bad. No, it's because they poison the water, they poison the air, they poison the food, but they basically poison your mind, and they didn't have to work that hard at it because you were sitting there watching TV, most of you, or listening to people that watch TV. And that's the bottom line. Okay, so what do they call it? What do they call it? The free press? There's nothing free about it. There's nothing free. Everything is enslaved. But understand, I will never be a slave. Either will Cheryl, either will Debbie, either will Magdalena, because they you know what they've done? They've taken massive personal action at loving and caring for themselves. And then they also took a risk. They spent a bunch of money getting energy medicine equipment, okay? And now when somebody comes to them, everybody almost that comes out of there, and Penny's on here too, when they come into the clinic, they usually go, oh my God, did that just happen? Did this just happen? I'm the guy that gives the money back guarantee, everybody. Okay, inflammation. They call it cancer. We call it inflammation. Has tripled in prevalence from 1982 to 2019. How many people know? How many people know that Richard Nixon declared war on cancer in 1971 and cancer was hardly even there? And then he declared cancer because the more you talk about something, the more you get it. And guess what? Does anybody know who started the American Cancer Society? Help me out, please. I mean, I'm just a snake oil salesman that just rolled out of the hole. Let me tell you something. It was the Rockefellers. In 1911, the Rockefellers started the American Cancer Society. And guess why? Because the more you talk about something, the more you create it. And guess what? The Rockefellers own 80% of all big pharma. Are we done yet? Are we done yet? And there's no such thing as cancer. It's all inflammation. And there's no such thing as any type of genetic cancer because you couldn't prove it. I'll give you $10,000 if you can prove it. I already know you can't. And then the other thing is cancer doesn't spread, inflammation spreads. So you show me a study where actually a cell actually mutates and then it goes into the bloodstream and goes to another organ and creates cancer. And I'll tell you that you're full of it. I don't care if you've been a medical doctor for 40 years, all you're doing is a parrot thing. You have not one study that proves that cancer spreads in the body because it's inflammation like any other fire. And that's the God's truth. 1913, the Rockefellers created the American Cancer Society, not 1911, okay? And they have been making money off of you since. And guess what? I don't know. Have you seen a doctor get $3,000 to $5,000 for prescribing anything else? They do it when they prescribe chemo. That's what they get. That's their kickback. Why would you have to pay somebody so much money if it was actually good for them? Why aren't we, where's logic gone to? Right out the door, right out the door. And now we got turbo cancer because the V is setting nobody free. Thank you very much, okay? All right, and in 1982, 12.5% of people experienced infertility. In 1982, but does anybody know why? Because they were pooping in their pelvis, okay, since 1960, since X-Lax came out. See, everybody thinks that when you get constipated, you're just supposed to blow that sucker out. Nobody looks at it like a compost. Nobody respects their good bacteria in their large intestine, even though it's 85% of their immune system. Now, guess what? 17.5% of people have experienced infertility. Okay, so understand something, guys. That study, okay, that study was done, okay, in in the year 2019. So we're already at 20. Okay, so two out of 10 women, okay, are infertile, which means that guess what? They have scar tissue in their fallopian tube created from the inflammation. Okay, that the inflammation was created from the infection from pooping in your pelvis, because every one of these conditions are mainly because you've been pooping in your pelvis and you didn't even know it. Well, guess what? If you look at a human being, where are they the chubbiest? Well, they're the chubbiest in the main part of their immune system, which is their core, which is hanging on the floor because they're rotting out because they have their own manure pile. So do all the parasite cleansings you want, but until you get rid of the manure pile, there's no parasite cleanse that's going to work. And if I can just say this, I'm going to be doing a show with Tim and Tara. They are actually practitioners. And guess what? They gave their cattle ivermectin. And guess what? Did you know when they gave their cattle ivermectin, they were doing it because everybody was telling them to do it? The poop that was coming out of their cattle, that guess what? No bugs would touch it. It was like rubber. And guess what? The bugs and the birds and the animals where they had their big cattle farm were gone. They stopped giving ivermectin to them, and it's taken them months. And now the bugs, the birds, and the animals are back. So so ivermectin might save a life, but it'll actually take a life, because guess what? There's no such thing as a good drug that doesn't kill the good bacteria in your gut. So now the manure won't even decompose to create the good bacteria to put into the soil so that you can have enriched soil so that we can have great food. Everything is a dirty trick out there. Think about it. Okay. In 1970, 15% of adults suffered from obesity in the United States. Okay, are we ready for this? 39%, might as well say 40, 39% of adults suffer from obesity in that's obesity, that's not even being overweight. We're talking about obesity, guys, all right? Now, in 1990, 4.9% of people suffered from diabetes in the United States. Okay, now, guys, this is an adult onset diabetes. Adult onset diabetes, okay, you ready for this? 87% of the Americans are pre-diabetic. Now, as far as stage 1 diabetes, you know, the type that you were born with, but you weren't born with it, they lied to you. It's gone up from 4.9 since 1990. And do you want to know where it was in 1950? You hardly even heard about it. It was more rare than cancer. It was more rare than any other disease. Guess what? Now it's 10%. So that means that 1 out of every 10 people now are going to be diabetic and needing insulin for life. It's not a genetic problem, okay? It's an epigenetic one. All right. And that's that. Okay, Penny, would you like to come on and tell everybody about, can you please bring up the other slideshow? Penny, can you come on and tell everybody about your Cellsonic Roadshow? Cellsonic Regeneration Roadshow.
Hello, everyone. Can you see me okay?
We can see you. Yep.
Hi, my name's Penny. I'm from Indiana, but I traveled with my Cellsonic Regeneration to my wonderful friend Dana's practice here in North Carolina. It's been an amazing experience. We've so far treated about 60 clients in the last 3 days.
60 clients in the last 3 days.
60.
And you're still standing.
I'm still standing, and I still have patients coming through the door. So it's been wonderful. Everyone has had amazing results, from tumors to low back pain, sciatic, necks, breast, pelvics, just a little bit of everything. Broken ankles. I think I've seen about everything, to be quite honest.
So anyways, just so you know, everyone, they're coming getting cell sonic regeneration. Okay,
Yes.
if I can, let me see here. Can you bring up the cell sonic regeneration slide, please, so that people can see it? Anyways, so they're coming there for cell sonic regeneration. They're coming there. Are they also getting Wolf non-surgical and cardio med bed therapy?
They are. They're getting the whole setup. They get, after they get cell sonic treatments, then they go over to the cardio med bed. So these patients are all leaving here feeling pretty good.
Beautiful.
Actually amazing.
Okay, so can you give me like one or two examples of people that, you know, their vibration kind of hit you a little bit when you were working on them, their story?
Oh, there's been several. The one that sticks out to me, we've had an elderly gentleman. He's been coming to Dana's for quite some time for his congestive heart failure. So he's been doing
Is Dana there? Is she by you?
She is. She took over for me right now, so she's doing
so
some treatment.
She can't come on though. She's busy.
Not yet. Not yet.
Okay.
Give her about 5 minutes.
Okay.
But the one that she's working on, she's another great story. I'd love to share her results.
Well, please.
But we had an elderly gentleman with congestive heart failure. So he's been coming to Dana's, getting Wolf non-surgical treatments along with the cardio med bed, and he's really had some great results. The past 2 days, we decided to do his low back, and he came back because he had so much relief in his back. The pain, he actually had fractured. He had fallen and fractured his right between the it was between T1 and T5. They weren't quite sure. So we just cell sonics the whole lower back, and he felt so much relief. He came back again today. So we sent him out feeling pretty good. Another client, lower feet, lower extremity inflammations, having problems, neuropathy. She's been getting amazing results. She couldn't believe it. Said she was in tears this morning because she could feel her feet when she touched the ground. So amazing.
Penny,
I mean, we've had so many results, so many.
Penny, what do you think of Penny?
What do I think of Penny?
Yeah, what do you think of Penny right now?
I'm bomb. No.
Yeah,
It's
aren't
been
you?
great.
Huh?
Yes. I mean, I'm tired, but tired in a good way. I mean, it's been a great experience all in one. I mean, in 3 days, Dana, I'm so grateful to have the experience to come here and help her with her clients and the experience I gained doing that. And,
How do you feel now about the purchase you made on the cell sonic regeneration?
Oh my gosh, it's the best decision. It is the best decision I ever made. I mean, it is amazing. I mean, even like these results with these patients, it's like, whoa, like we're seeing things change right before our eyes during the treatments, like inflammation, the swelling going down immediately, scars. I have this one younger guy, he had a surgery, shoulder came all the way around the scapula. It was really, really, really long. Yeah, I mean, it just transformed the look of it, the whole shape of it in one treatment. It was just amazing. And then also Mitch.
Well, tell Mitch to get in the picture. I know he's big. Tell him to get over there.
Hey, Doc, how are you?
Hey, Mitch, how you doing, big fella?
Hey, I'm great. I had some great results, man. Awesome results. I haven't been able to have feeling in my neck and my spine since I broke my neck when I was 16 years old. And Dana does non-surgical on me every week, but the cell sonic really broke it up, and now I feel amazing. This is the first time I've been able to sit through a whole night in like 15 years.
That's wonderful. That's wonderful.
Yeah.
So you guys are keeping really busy there, eh?
Yeah, like I said, she's seeing 64 clients right now. She'll probably do we still got another 7 left before she leaves tonight. We had a lot of great results. Like she was telling you about Steve. Steve is a client of ours. He's been a client for ours about 8 months now. And the doctors gave up on him. They told him that, they didn't expect to see him again. And so when he walked in for a 6-month checkup, the doctor's like, "What are you doing?" And they said, "Well, I'm used to the cardio med bed." And so they reached out to us and said, "Well, we got other clients that need help. And we want you guys to really try to help them." But you know how that goes.
Beautiful.
Yeah.
Thank you, guys. Thank you, Penny.
Dana's coming right now.
Dana.
Okay, all right.
They found me. I was just treating some clients. Hey, Doc. Nice to see you. Hey, everybody.
Nice to see you too. Everybody,
Yeah.
This is Dana, and Dana has a clinic, and she'll tell you where in a second. So will Penny. And Dana got a cardio med bed. And how long did it take before you had your cardio med bed paid off?
3 months, about 12 weeks, 12, 13 weeks.
That's right. That's right.
Yeah.
And understand, and I don't mean to be like this, everyone, but you know what? I was already saying, Dana and Penny, before you came on, that, what we could get away with doing as practitioners doesn't work anymore. It doesn't work. If you don't know how to change scar tissue back into beautiful connective tissue and bring the oxygen and the electricity right down into the deepest part of the cells and restore the circulation throughout the body, then you're only going to be just slightly turning the burner down. I just want to say this to everyone. Are you tired? This is not, what do they call those shows that are on late night? This is not some kind of commercial. But are you tired of going into the same practitioner? I'm not putting down any practitioners, but guess what? If they're not willing to bring the thunder down and restore the oxygen, the electrical conductivity, decalcify the mitochondria, because that's where all the damage starts, and not restore the circulation, what's going to happen, Dana? What do you think?
Yeah, well, I can tell you, Doc, I have almost all my clients that come in, they'll say to me, "Why didn't my doctor just tell me about the med bed?" They're like, if they told me that I needed better circulation, but no one told them. And I'm like, that's what you need. You need the circulation, you need the cell sonic to help you open up the scar tissue, the crystallization, get that blood flow back in there, and then your body will heal itself. You just have to give it the right environment when healing. But it's just not available to most people. And that's why this is so amazing. Like, if you come to Penny in Indiana, I'm in North Carolina. Penny's actually at my clinic right now, and we're using the cell sonic and the med bed. For all the people that came in, we've treated, I think, about 70 or 75 people in the last 3 days. And I gave away like a, what do you call it, raffle for the cardio med bed. So each day somebody won a 30-minute free session just to try it out and see what it's all about. And we have so many, and actually I can hear the med bed going right now. So I think we have one of those people on there. So all three of the treatment rooms have been busy the last 3 days. We have a treatment room for the med bed. We have a treatment room for non-surgical and cell sonic. And then we also have a treatment room that we use for additional non-surgical treatment, but we also have an infrared sauna in there. If I turn this camera a little bit, oops, the other way, sorry about that. If you can see, those are Doc's charts there on the large intestine and the organs in the body as well. But that large intestine, I just talked today, and Penny worked with the cell sonic on an 8-year-old girl that only goes to the bathroom once a week, and it's a rough time for her that one time a week she's going. So we came out, looked at the chart together. I talked to her and explained to her. She's a very intelligent young lady. She goes to a private school, so her education's on point. She's listening to me, and I showed her how to do massage. We talked about what she should be eating. And we also, of course, did the cell sonic to help her kind of move things along more naturally. But then I also talked to her about enemas and how important those can be. And her mom's on board with it because it's been so severe that she has been in emergency room for it and a lot of other things. So today with the cell sonic, we could literally hear the scar tissue up near her splenectic flexure of the large intestine. Excuse me, and her whole colon area. So I showed her on the chart that you can see back there. If you don't have one of these for your practice, get one. I showed her on the chart exactly what's happening in her colon and in the large intestine when she's backed up. And so we just talked about massage, and we talked about coming back as soon as I get myself sonic to come back and get those treatments and just get her moving. So, because Penny here has had similar problems when she was a child. So this has been super helpful. She was able to talk with the young girl about what some of the things she could do, so she doesn't end up with scar tissue. So that Cellsonic, I can tell you, helped her today, because for such a young girl to have that kind of thick scar tissue, that's not getting any better as she gets older. So the only thing that's going to help her right now is Cellsonic, proper enemas done on a regular basis, as well as nutraceuticals. And you all know that Doc's nutraceuticals, top of the line, right? Top of the line that actually work. If you want to spend your money somewhere else, you can do that. But most of the products that you're going to find are not going to do what Doc's products do. So keep that in mind. Okay, I talked a lot. I'll be back on the 5th, actually. So you want to
Dana,
talk to me
and
some more?
everybody, just so you know, Dana's going to be coming on and doing the Cardio Medbed show. And we're going to be talking about that with Marie and myself, everyone. So watch for that show coming up. And Dana, why don't you tell everybody where your clinic is, how to get in touch with you. And Penny, you do the same thing. And listen, everybody, I developed with my graphic artist the digestive tract and all the things that go wrong in the pelvis. And those 2 charts that Dana was telling you to get, you want to go to Doc of Detox store and order them. Your kids are going to love them. Those charts are going to teach you more than your kids are going to get through their whole education of the school, especially if you take and go to the docofdetoxlibrary.com and watch how to become number 1 at the art of number 2. Okay, all right? Just go and have your kids watch it, because guess what? Every bowel movement is a computer printout. Dana, please tell everybody where your clinic is, and Penny as well.
Sure. I'm in Central North Carolina, about an hour and a half from Charlotte and an hour and a half from Raleigh, in a place called High Point, North Carolina. It's near Greensboro and Winston-Salem. It's called the Triad. You can reach me on my phone, is probably the easiest. Please don't call. It's very difficult for me to get back to you, but if you send me a text, then I can get back to you, and I make sure I can do that in a timely fashion. Okay. So the number you can reach me at is 315-360-2467. Again, 315-360-2467. And I'm in Central North Carolina, and I've got a couple more hours that we're going to be using the Cellsonic. So I've got some clients here now. So I'm going to go attend to those, but I'll see everybody on the 5th, and I'll turn it back to Penny there.
All right. So I'm located in Union Mills, Indiana. You can contact me. You can call or text. My number is 219-309-7092. And along with Dana, I'm going to go help get these last few clients completed before I head back home. So thank you, everyone.
Thank you, Penny.
Bye.
Bye now. All right, let's bop over and talk to Cheryl in California. Cheryl?
Hi, Daryl. Well, it's just exciting to hear all those amazing stories. I love that. And I am located in Northern California, about 60 miles north of San Francisco along the coast, in the cute little town called Occidental. Well worth the trip. And, you know, it's so interesting that she was just talking about young children and constipation. I had the exact opposite, where I had a woman come in who just turned 85, who goes to the bathroom once every 10 days. 10 days, and she's in so much pain. And of course, it's affecting her hips, it's affecting her lower back, it's affecting everything. And so besides educating her on what she should be eating, also on the enemas, ultimate enemas, I got her into doing the Cellsonic, and she allowed me to do a Wolf non-surgical on her abdomen. She didn't even make it home before she had to pull over into a rest stop. And she had one of the biggest bowel movements she said she's had in a long time. So she plans on coming back, because sometimes you need more than one treatment to understand what causes that inflammation and to make that massive personal change. Because once you feel good and once things are moving, and let's face it, when things are moving, you have all kinds of energy and you feel better. And then I also have, something that touches my heart is my son, Mitchell, who's only 36. And he was in an accident where he broke his neck. And so they put in the cage in the front and the back. And so he had massive scars down his back. And it isn't just the fact that he has this injury, it's the fact that he sits at a desk, not ergonomical. And so it starts to affect his whole body. Well, he lives 3 hours away from me. And I said, you need to commit and love yourself. Take a vacation and come see me. I need 10 days. I need 10 days every day. I need to work with you. And it's something for me to have my son sitting there and I work on his lower back and watch him just sob because he's free for the first time in like 6 months. At the end of this 10 days, he had a bounce in his step. I've never seen him smile more. He was laughing. He was telling jokes. It was like he got his life back, because when you're living in pain every single day of your life, you're going to lose. Your frequency gets lower and lower and you stop finding your happy thoughts, right? And so just that little boost. And of course, for me as a practitioner, when I see that in anybody, it is just magic. I also have another client from Nevada who comes down to see me. This is her second time. Also chronic pain for years, to the point where she couldn't find a reason to live, kind of chronic pain. And I see that's what happens with people. So also educating her, because, coming in and go, just fix me. Well, it's not going to be a quick fix. We've got to change your diet. We've got to change how you love yourself. You certainly have to change how you talk to yourself. But yes, she couldn't even lay on her sides. And so we worked, and I really worked her with the Cellsonic and Wolf Non-Surgical on both her hips, her lower back. The next time she came to see me, 2 weeks later, she said, I'm sleeping on my side. I am actually sleeping on my side. So, it is step by step. And she is coming back, and now she wants to get better and she wants to heal. And it's very exciting. And I also have the cardio med bed. So everybody gets to get on that cardio med bed that comes through my clinic, which means you're getting that much more of a boost, right? You get that circulation going, get the Cellsonic in there, which is breaking up scar tissue, inflammation, calcification, get the Wolf Non-Surgical. You can't help but be in better shape when you leave. You can't be any different than that. This is where the miracles happen, is right here, because we have the ability to help people heal. And I just love being part of that. So I am at Health and Vitality Engaged, which again is in Occidental, California. You can call or text me at 707-322-1979, or you can go to my website, healthandvitalityengaged.com. Be absolutely excited to see you.
Thank you, Cheryl. And did you see what Cheryl said, everyone? Understand, we don't cure people, but I'll tell you what we can do. We can bring up the vibration on an emotional, physical, and mental level, and you go, I remember this feeling, this pain-free feeling, no inflammation, no swelling, no stiffness. And then guess what? Did you hear what she said? This is what honesty does. But I'm not going to just fix you. I'm going to teach you how to stay there. You know what? This meat suit, okay, all right? If you think that it's chopped liver or hamburger, it's going to look like it, okay? If you want to respect it, it's going to light up your life. And anyone out there, don't you dare believe anything they say when nothing can be done. What they actually said, if we were to do an English translation, I don't know what the hell I'm doing with this. People are not bad, but they have bad beliefs and they have limited healing ability. Now, limited healing ability doesn't mean we heal you. Limited healing ability means that they can't bring your vibration up long enough and strong enough that you can feel where you can go if you decide to take massive personal action. What do you think, Cheryl?
I think that's absolutely right. And I just want to tell people, please value yourself as much as you value going out to eat. or any of the other things that we actually go and spend our money on. I find that people put themselves at the bottom of the list when it comes to doing what is available to get better. So love yourself, make it happen. Change your thoughts and how you talk to yourself. That's just an amazing way to start. I get up every morning and go, wow, I love you. And I love the life I've created. I'm happy. I see the people around me making these choices, and I think, wow, that doesn't affect me anymore. I don't get affected by the world anymore. I am in my happiness world, and I'm creating my reality. And I love the opportunity to help you help yourself.
And we don't know when, but we do know that eventually I will be coming to do a lecture in California for Cheryl. Okay?
Yes. That's going to be exciting.
Thank you, Cheryl. Magdalena from Toronto, would you like to talk about your clinic?
Hello, everybody. Beautiful, brave hearts around the world. Amazing souls having an experience in this earth. We are an electrical, magnetical spirit being. Dero, how are you? It's so nice to see you. You're looking great.
Thank you. You too, love.
Thank you. Most important, very thankful for all the teachings that we learn. And I am in Toronto. My name is Magdalena Arcos. I'm excited to be here and share all about how we can heal ourselves. It's very simple. I did a treatment on a lady. She had a bump in the head. She came and she was having headaches. So I gave her the treatment, and the bump was gone and the headache was gone. She was really impressed. I spoke to her. I said, I want to mention your experience on my show. And she goes, yes, please go ahead. She was really, really happy to be healed.
What was the bump? Was it some kind of lipoma, or was it hard? What was it?
It was something was sticking out here. You know, when it was just a bump in here, right in here.
Was it calcified? Was it scar tissue, or was it more jelly-like?
It was like jelly, but it feels like like a jelly-like.
Okay, everyone, that's called a lipoma. That's a lipoma. And people get them. You know, and don't get me wrong, I'm not trying to pick on anyone, but if you want a bunch of lipomas, just eat as much pork as you can. Okay, and whether you believe it or not, lipomas are are you ready for this? Parasitical nests. That's where they actually lay their eggs. So people with lipomas all over their body, they're full of parasites to the point that they have became the host, not the guest. Okay? All right. So believe it or not, did you hear what she said? She used the cell-sonic, okay? And after she used the cell-sonic regeneration method, what happened was, on the lipoma, it was gone. Does anybody know why? Well, we can use ointments, we can use drugs. Everything is to try to create a vibration in that tissue, okay, that we get rid of the issue. Okay, I tried to tell you this, that back when I first started practicing, it was a 2-foot hole. Everybody's coming with a 20-foot hole, and they're going, give me a 2-foot ladder. You climb that sucker 10 times, you're not out. You might feel like you're getting out, but then you keep on, just like a revolving door, you keep on going from practitioner to practitioner until you bring the thunder down. And the thunder is called electricity, everyone. You do know that, right? With every thunder, there's lightning. That lightning is electricity, and that thunder is the cracking of the cell sonic and giving 20,000, wait now, give me a second, I just lost my thoughts, but 20,000 volts in a love harmonic, which couldn't hurt a soul, but guess what? But actually changes the frequency all the way down to the cell and says, you're not sick anymore. and drives out the parasites, drives out the bad bacteria, decalcifies the calcium around the mitochondria. So it's all about electrical energy because we are spirit beings. So when Magdalena went and worked on this lady, she had an aha moment. And guess what? Everybody that comes to a practitioner, they've been taught you got to cut it out, you got to burn it out, or you got to poison it out. And guess what? We have learned to dishonor and disrespect ourselves. Magdalena, anything else you'd like to say?
Yes, and she was very she started crying. It was emotional because she started crying. She couldn't believe the bomb was gone right away. So it's amazing how this sonic rejuvenation of cells is amazing. How 20,000 volts and I love harmonic.
And also, just so you know, Magdalene is just north of the Highway 401 in Toronto. And I have done lectures for her. I'm going to be lecturing for her. She can give you the date, everyone. But I'm going up there in October to lecture in Toronto, everyone. And then I'm going to be going to also Calgary to lecture for Lorraine. And then I'm lecturing in Kelowna. And then I might be doing a couple of lectures on my way back to Ixtapa, Zihuatanejo in California. But I can tell you that last time I was there, Magdalena was so busy with scoliosis. Okay? Now remember something, we don't treat disease, we help create alignment in people. You have to understand there are no diseases, just symptoms. And symptoms, but we call them names because if I said you had arthritis, you'd think it was in the hands or the feet or the spine. If I said neuropathy, you'd think it was in the lower leg. If I said sinusitis, you would know that it's in the area. We don't treat disease. We just bring back alignment to the cellular level. And that's all you've ever tried to do. You know what? So guess what? If this lady could have went, and guess what? Are you ready for this? How crazy is this? This lady could have gone and got that lump cut out and then had them sew it and had a scar there? Okay, wait a minute, Daryl, you're full of it. But we actually put electrical charge in there and it disappeared? Where'd it go? Because energy is everything. The invisible creates the physical, and the invisible will take away the physical that you don't want if you become aligned again. And guess what? Does anybody know that in 1910, okay, the Rockefellers gave $100 million to the AMA to crush every herbal, chiropractic, acupuncture, nutritional school in North America. And at the same time, okay, at the same time that they did this, they did a lot of other things that are not so nice. All right? And the reality is you don't know what you are, you don't know what you're capable of, and guess what? This show is to bring back your authentic self. This show is about you realizing that you are a spirit being, have had unlimited potential. And understand something, the matrix will never fall, but it will fall for you if you decide that the U stands for universal. And that means that you need to become your own hero, your own practitioner, your own Braveheart. Magdalena?
Yes, that's correct. I have also, I spoke to a gentleman I did in your country, in Mexico. He has an ulcer, and I mentioned to him, immediately you have to go plant-based foods. So we have the best nutraceuticals and the best teachings to learn how to heal ourselves. And with the good thoughts, and you have to believe that you are healing. So in the next 2 days, he said, my ulcer is healing. I have less pain just by going plant-based food. And change your thoughts and change your life, because you have to think positive and believe that you are healing. Don't believe that it's going bigger. Your ulcer is going smaller and it's healed.
Isn't that something, eh? Isn't that something? Guess
Amazing.
what? Everybody has to understand something, and you got to get this. Whatever you put out to the universe, he has that ulcer because he put that kind of vibration out. He will get rid of that ulcer when he puts that vibration out. Understand something, there's nobody more powerful than you for you, and you need to get that. Let me tell you, I only focus on what I want and what I deserve. And I'll tell you what I deserve. I deserve everything. And understand something. I am grateful for everything I have, but I want more. I am no better than anybody else on this planet, but I will have a better life than anyone on this planet because my thoughts are everything. What do you think, Magdalena?
I think yes, we need unconditional love for ourselves. When you love yourself so much, unconditional, you heal yourself. You believe in health, good health. You love yourself and you love everybody. And then you don't feel that you don't get sick because you don't hate anybody. These emotions make you sick.
That's perfect, Magdalena. Do you want to let everybody know where your clinic is and
Yes.
also when I'm coming?
Yes, Dr. Daryl is coming to Toronto and we are all happy. Toronto is waiting for you in October the 20th, Sunday. So Monte Casino Hotel, the same location that we did before. And we are waiting for you on October the 20th from 10 a.m. to 3 p.m. And we will greet Dr. Daryl at 9:30 a.m. So see you all there. Everybody's welcome to come.
Yeah. And make sure that you call Magdalena, okay, or you go to bhnuniversity.com to book your seat, just so we have an idea how many people are coming, right, Magdalena? And
Yes,
how do they
that's
get
right.
in touch with you, sweetheart?
They can call me at 416-669-9351 and my website, torontohealthandhealing.com. Thank you, beautiful people, and have the best day of your life.
Thank you. So far we've got Cheryl, Penny, okay, Dana, and Magdalena. And now let's head down south to Debbie. And Debbie's already hosted me there for 2 trainings. And we're going to be going back for a 3rd training in the spring. And she has an unbelievable business where she doesn't just help humans, but all our practitioners help pets. But Debbie's known as the pet queen. So Debbie, take it away.
Hi, everyone. My name is Debbie, and I'm here in Stuart, Florida. And we just love it here. Beautiful temperatures. It's a little warm right now during the summertime, but we have great winters. And it's just been amazing times here and hosting you and getting ready to do the 3rd time, which is going to be real exciting. So it's just going to be great. Each time gets better and better. You know, one of the things that you talked about earlier was the age that people are having a lot of problems and issues, and it's occurring as they're younger and younger. And so that's what I see a lot of. Is I see people that are in their 20s and 30s that have their SI joints, which is their lower back problems, like someone who could be in their 60s or 70s. You know, it's just seeing this. I had even a 38-year-old male that was 38 that they told needed a hip replacement at 38 years old. So this is the stuff that we're seeing. And of course, you know, it's the thinking and the food and the water and the chemtrails and everything that goes along with that. But this past week, I worked on a young lady. She's 51, and she has a lot of stress in her life. And she had 3 C-sections. She's been constipated her whole life. And she was smoking. She stopped the smoking. But the biggest thing was she just couldn't get a breath. She just really felt that she couldn't get a breath. And I just worked on her chest. I cell-sonicked, the sternum, the costochondroid area, the intercostal muscles. And, I did non-surgical and miracles happened. She sat up and she was like, I can breathe, I just can breathe. And just it's, you see this, a lot of the treatments, it's funny because we got to get people back to a great mental state. The stress is so high out there right now. And I'd say the majority of my talking with them while we're doing treatment is just to get them back to where they get to love themselves and they can create an environment within their home and families. So that way they can start the healing, because, you know, they're not in this position because everything was all great. So it's just amazing work. The Cellsonic, the non-surgical, the whole life coach, learning how to talk to people, how to love yourself, teach them, you know, the mirror work, just everything, along with the nutraceuticals. I just love it. Every day I get up and have a great day, enjoy the work, enjoy teaching people how to do it. I'm just so much more intuitive since I took your first class, and I did take 6. I can predict things like you can't believe, Doc. I, you know, had another one. I told Dina last week, or no, it was a couple months ago. We worked on a person who was a friend of hers, and she wasn't in the right state of mind to start healing herself and everything. And I already knew. I said, within the next 3 months, she's going to be diagnosed with stage 4 inflammation in the abdomen, and she just got this diagnosis this past week. So I'm enjoying the fact that I just have become so much more intuitive because of the tools that you have given me, which is available for everybody if they just take a whole life coach, if they take the non-surgical, if they start learning to recognize these things. And, you know, it's if she wants to come back and get help for her stage 4 inflammation, we'll be willing to work with her. And if she goes the other direction, that's, you know, her business too. But, you know, we know that we can reverse everything. And all it takes is getting in that right frame of mind and teaching you what you should be eating, what you should be drinking, and how to love yourself and how to think. And this is great. Life is wonderful. And yeah, you can see it on my face.
I know you're looking great, Debbie. You really are. I'm telling you, you're looking great. Okay.
So.
Everybody, you have no idea how much power you have. You will make, okay, the biggest billionaire tyrant crap their drawers when you fall in love with yourself and make loving decisions for yourself and your family and hold the line. Let me tell you something. They fear unconditional love. They don't fear love because it comes and goes. But if you have unconditional love for yourself and the world, you're untouchable, and you're putting out to the universe that you're open for greatness. Debbie?
Oh, I'm open for all the greatness that there can be. And life has just been great, and it just keeps getting better. Every day with me, it's better. You know, we just have a great time. We laugh. And, you know, I manifest everything. And it's true. What you put out is what you get. And like you, I want everything that there is that this life has to offer me. And that's what I'm going to get. So if anybody needs to learn how to start healing and helping themselves, you can reach me at 305-342-9559. And I'm here in Stuart, Florida. And you can check out our website at stuarthealthandhealing.com. And if you have any questions, whether it's about people or dogs and animals, I'm here. I take phone calls. I get calls all the time, just even simple things as far as, you know, what should I be feeding my dog? And, you know, with my new puppy, who is now just over 4 months, you know, they had put him on the typical puppy chow, you know, kibbles and garbage. And he started having that inflammation that was showing that, you know, was dripping out of his eyes. And my mom's dog also had the eye, I call them eye boogers, because there was so much, you know, crap coming out of the eyes, and it would get caught in the fur and you'd have to cut it out. As soon as you change the food, and it took about, like you said, it took about 6 weeks, 7 weeks for it to completely clear up with him. And my mom's dog, I finally convinced her, let me get this food, and we changed her over. and nothing dripping out of her eyes at all. You know, they're just living healthy lives. That just goes to show it's not only the dogs, it's also the people. It's important what you put in your mouth because it's going to affect you the same way. And I always say to people, you have to give yourself time to heal because you didn't get yourself into this mess in 1 week. You went 50 years, 60 years, whatever your age is that you've been putting in the wrong things. It takes some time. So you have to have patience, and it does take multiple treatments, and it takes massive personal action to do the clapping, to do the ultimate coffee enemas, all these things that we're going to give you, these tools that you have to go home and you have to apply them in order to get the great results. And the thing about it is that those are the easy and cheap things to do. Clapping, the ultimate coffee enemas. You just see miracles happen when you do this stuff.
And for women, vaginal infusions are the thunder.
Yes.
Yes.
I did mine last night.
Oh, is that why you're glowing? Good. Very good. You know what? I just got to tell you that all of these beautiful women, they make everything that I do worthwhile. You know what? That's what it is. Whether you believe it or not, I'm going to tell you something.
Did he freeze up?
Did I freeze? No. I don't think so.
Yeah, you froze.
Okay, well, I'm back. So I was just saying that these beautiful, strong women here, they make it all worthwhile, don't they? They make it worthwhile because they're out living their passion, their purpose. How would you like to actually, get your power back, that you can actually influence people with your light and your energy? And that's a serious thing, really, truly, everyone. Cheryl, would you like to give everybody your phone number and your address one more time? Because I know people don't write them down. Get your pen and papers out if you're from California, everybody. Cheryl? You're on mute.
The host keeps muting my thing for some reason. But yes, you can reach me at 707-322-1979 and healthandvitalityengaged.com. Please come see me. You're worth it.
You are. Magdalena?
My number is 416-669-9351. Toronto healthandhealing.com. I am in Toronto, Ontario, Canada. Thank you. Have a wonderful day.
Thank you, Magdalena. Debbie?
Here in Stuart, Florida, StuartHealthAndHealing.com is the website. And my phone number is 305-342-9559. And give us a call because we'll discuss whatever you want to talk about.
Thank you, Debbie. Thank you, girls. And just know this, everyone. Look, there's people out there that are sitting on the fence. Whether you're a practitioner or a doctor, a gym or a spa, a patient or a client, if you've been thinking to become a health practitioner, just know this, okay? Check out braveheartnation.com or bhnuniversity.com, all right? We do the whole life coach certification. We do the Wolf non-surgical body work. We'll give you a money-back guarantee that will blow you away by the 3rd day. And then we do the 3-day Women's Pelvic Restoration Masterclass. Okay, now that's a masterclass, but the other two are certification, and you can practice anywhere in the world. And you can open up a business after you leave here taking it the first time. I think every one of these girls will tell you they went back home and they opened up right away. Don't kid yourself. You can go to school and become a medical doctor and never learn about health. Or you can learn about health on all levels from us. Okay, and you can release the practitioner from within. And everybody, we talked about the Cellsonic, we talked about the Cardio MedBed. Every time somebody gets a Cellsonic regeneration, they get a full training for free. When they get a Cardio MedBed, they can pick one of the trainings, either the Wolf non-surgical or the whole life coach course. The next course is here in October the 7th in Ixtapa, Zihuatanejo. This is one of the most beautiful, peaceful places. The beach is 5 minutes from the training. Our training is being held at the DOD 5-star. And if you go to DOD5star.com, take a look at this beautiful home where we do all our trainings and where people come to stay to heal in Ixtapa, Zihuatanejo, Mexico. I don't want to keep going on, but we are bringing our Braveheart Nation app, BHN app, out on the 15th of September. If you want to go test drive it, go to bhnapp.com, bhnapp.com, and understand something, everybody. It doesn't matter what you've done. You haven't even done 1% of your potential. We're created by God Almighty. Let's start acting like it. 3, 2, 1. We got this, Bravehearts.